When we think about behavioral health, we look at what is health, and it's, having enjoyment in your life, being healthy, physically fit, mentally fit, spiritually fit, whatever that definition encompasses. When we look at behavioral health, we're looking at these different behaviors that we have in our environment and how they contribute to our health. So when you're in the behavioral health field, you're helping people learn new skills or improve the ones that they already have to improve their overall quality of life.
I wish I had known more about behavioral health when we were raising my daughter. We lost my daughter in 2022 to a drug overdose. We are currently raising her son, who is 7 years old now. We had a situation where there were multiple traumas that happened in a very short window of time that caused him then to have outbursts. I mean, there's so many people connected to helping a child. I can't even necessarily describe how all those different pieces a behavioral health person brings to the table.
We think of mental health or behavioral health as quack things, but they're not. We think of neurology as very esteemed and, a really good career to go into. But yet psychiatry and psychology and, therapy, why are they deemed not so much? One's physical health, one's mental health, but yet they need each other to be full. They're both considered for the brain. So we need to come together and dispel those myths so we can be very fully, well-roundedly healthy.
We say that every behavior is a form of communication in some way. So these kiddos are trying to communicate with us in whatever way they know or can get attention of what's going on and what is bothering them. So being in behavioral health for so long, I can recognize that. But for somebody just seeing a child acting out at the grocery store or things like that, they really don't encompass what the behind the scenes or what might be going on with that kiddo.
Being able to learn, wanting to learn, and constantly playing detective. Why is this happening? What's going on that's creating the situation where the child feels that they need to act in this way? And figuring that out, so that true sense of curiosity as well, you bring into work every day. For somebody considering a career in behavioral health, I would recommend they try it out first. One of the programs we work with is Pathways to Careers through the local high schools. And so we get high schoolers come in and they act as our center assistant. They can't work one-on-one with the kids because they don't meet criteria, so they can't bill, but they help us out tremendously. And that program has worked really well for us. We've had quite a few of our center assistants turn into technicians over time. So I think just being able to jump in, have a good sense of humor, being able to get down on the floor and play, which a lot of adults forget how to play. We've actually had trainings to reteach staff how to play, and just have fun. And if you have fun with it and you enjoy going into work every day, you're doing something right.
Working with children and helping them to grow, giving them the skills to navigate the world, that they need to function in every day can be stressful, but also rewarding. What I would recommend going into behavioral health is possibly even reaching out to a provider, maybe shadowing some therapists, sitting in a meeting. There's a very large scope of human services degrees that you could go either way and still do behavioral health.
I've heard people say, you've got to be in it because your heart is, not because the money is. And that can be a myth because, well, first of all, your heart has to be in it. You cannot do this work if your heart's not in it. There's no physical way or mental way to do this if your heart's not in it. But as you move up through, or if you pull the hours, you can absolutely pay your bills with this as well. So it's not minimum wage, and staff as they move up or as they further their education, there's also pay increases with that in the field as well.
For anyone looking into behavioral health as a career, go for it. It's the first and foremost My biggest thing to say though is don't get too comfortable. And that sounds negative, but it really is not, because every day is different. It's one of the best things about the job though. It's never dull, it's never boring, it's always different. That's the best way to grow though.
I'm just so thankful. I hope that more people step into this field and have a heart for the children, for connecting with the parents, and that the parents know that this resource is available. I am just hoping in some way my story helps you to consider a career in the field of behavioral health services.